Never ignore this warning, especially if you're experiencing any of these signs. Pharmaceutical companies are required to disclose a dozen side effects, yet most patients never connect their symptoms to the drugs they take. The eighth side effect is so often overlooked that it sends 15% of chronic users to the emergency room, and it could already be happening inside your body right now without you noticing. Amlodipine, with more than 70 million prescriptions a year, currently ranks 6th among the best-selling drugs in the United States, meaning about 1 in 3 adults over 40 takes it. While this medication is very effective at lowering blood pressure and, according to the largest clinical trials, can reduce the risk of heart attack by up to 64%, recent safety monitoring data show that 1 in 8 people officially report an adverse reaction. Even more troubling, for every reported case, roughly 10 patients are either unaware of the symptom or don't attribute it to the medication. First and foremost, I want to stress that this is not an invitation to stop your medication on your own. Doing so can be extremely dangerous and irresponsible. Some people believe all drugs are poisonous and must be avoided, others assume widely used medications are completely harmless. Both extremes are wrong. Our aim is to help you recognize symptoms and side effects so that, without panic or fear, you can speak to your doctor as an informed partner in deciding what's best. Over the next 10 minutes you'll get a clear, straightforward guide to the 12 most dangerous side effects of amlodipine, including one that affects a third of users but is rarely discussed when the prescription is written. Get ready to take control of your health with full awareness. 1. Swelling of the limbs, peripheral edema. One of the most troublesome side effects of amlodipine is swelling in the feet and ankles, which occurs in roughly 10 to 15% of users. This swelling usually appears as puffiness around the ankles, the tops of the feet, and sometimes the lower legs, often becoming more pronounced as the day goes on. The main cause lies in how amlodipine works. It relaxes and widens blood vessel walls to lower blood pressure. But when those vessels expand, their walls become more permeable, allowing plasma fluid and proteins to leak from the bloodstream into surrounding tissues. Gravity makes this effect particularly noticeable in the lower limbs, where fluid naturally pools. Studies show women are more likely than men to develop this swelling, and the risk increases with higher doses. At a standard 2.5 mg daily dose, only about 1.8% of patients report swelling, but at 10 mg daily, the rate jumps above 10%. This type of edema typically appears a few days to a few weeks after starting treatment. Many patients first notice their shoes feeling tighter or the sock marks lingering on their skin. These are signs it may be time to speak with your doctor about adjusting the dose or exploring other options. While the swelling itself is usually not painful, it can cause heaviness, discomfort, and difficulty walking or wearing certain shoes. Over time, the fluid buildup can lead to a puffy appearance around the ankles, feet, and lower legs, often worsening as the day progresses. 2. Angioedema. Angioedema is a sudden and potentially life-threatening allergic reaction that affects the deeper layers of the skin and mucous membranes. In this condition, parts of the face, especially the lips, eyelids, tongue, and throat, can swell rapidly, creating firm, uneven, and often asymmetric swelling. Unlike surface hives, angioedema occurs deep beneath the skin and typically develops within minutes to a few hours after taking the medication. This reaction is caused by the release of histamine and leukotrienes, which make blood vessels leak fluid into surrounding tissues. The mechanism can be allergic, for example, activation of the complement system, or non-allergic, such as through the bradykinin pathway. Early warning signs often include burning, tingling, or itching in a localized area, quickly followed by pronounced swelling, most often in the lips or tongue. Because there is a serious risk of airway obstruction, any sign of swelling in the face, mouth, or throat requires immediate medical attention or an emergency room visit. The swelling is usually firm to the touch, unlike softer, more generalized puffiness. In severe cases, it can extend to the throat and airways, making it difficult to speak, swallow, or breathe, a true medical emergency. One of the most alarming aspects is that angioedema can occur suddenly, even after months of taking amlodipine without any previous issues. Mild cases may resolve on their own within 24 to 72 hours, but if the airway is involved, rapid treatment is critical, typically with antihistamines, corticosteroids, and in some cases epinephrine. In life-threatening situations, doctors may need to perform emergency intubation to secure breathing. 3. Liver failure, hepatotoxicity. While liver injury from amlodipine is rare, it can develop suddenly and with serious intensity. In some patients, within days to weeks of starting the drug, liver enzyme levels, such as ALT and AST, can rise sharply, signaling significant damage to liver cells. For example, one documented case involved a patient who, after just 1 week on amlodipine, developed extreme fatigue, nausea, abdominal pain, and yellowing of the skin and eyes. Blood tests revealed liver enzyme levels more than 10 times the normal range, an alarming sign requiring immediate discontinuation of the drug and urgent liver supportive care. Amlodipine is processed in the liver, and certain reactive byproducts of this metabolism can harm liver cells. In some cases, this damage progresses rapidly and can lead to acute liver failure, which may require hospitalization and emergency intervention. Fortunately, if the medication is stopped promptly, the liver often begins to heal, though full recovery can take weeks to months, and in severe cases, some damage may be permanent. Anyone taking amlodipine should be alert for warning signs such as severe fatigue, persistent nausea or frequent vomiting, pain or heaviness in the upper abdomen, dark-colored urine, yellowing of the skin or the whites of the eyes. Early diagnosis through liver function tests, ALT, AST, and bilirubin, can prevent further damage and significantly improve recovery outcomes. 4. Peripheral nerve damage, peripheral neuropathy. Over time, amlodipine can sometimes cause damage to the peripheral nerves, especially in the hands and feet. This damage reduces sensation in small areas such as the fingertips and may trigger symptoms like numbness, tingling, or burning pain. Some patients describe it as feeling like pins and needles, while others say it's more like fire under the skin. It often begins subtly, perhaps a faint tingling in the fingertips, but can gradually progress to affect fine motor skills, making everyday tasks like buttoning a shirt or picking up small objects more difficult. In more severe cases, muscle weakness and balance problems may develop, increasing the risk of falls, particularly on uneven surfaces or in low light. Some people also lose the ability to accurately sense temperature, which can be dangerous if they unknowingly touch something very hot or frozen. This complication typically develops over months or even years and is more likely at higher doses. Recognizing the early warning signs and discussing them with your doctor can allow for dose adjustments or a switch to a different medication, helping to prevent further nerve damage and maintain quality of life. 5. Peripheral neuropathy. At the level of the peripheral nerves, amlodipine can gradually damage the nerve fibers in the hands and feet. Early signs often include mild numbness or tingling in the fingertips, but with continued use, this can progress to intense burning pain, described by some as feeling like fire or being pricked with needles. As the condition advances, it can interfere with fine motor skills such as buttoning a shirt or picking up small objects. In more severe stages, muscle weakness and loss of balance may occur, raising the risk of falls and injuries. 6. Extrapyramidal symptoms. In rarer cases, more serious neurological side effects can develop, similar to those seen with certain antipsychotic medications. These are called extrapyramidal symptoms, EPS, and may include persistent muscle contractions, dystonia, resting tremors, severe restlessness, akathisia, or even involuntary upward eye movements. Such abnormal movements can be painful and may disrupt essential daily functions like speaking, swallowing, or walking. Early recognition is critical to avoid misdiagnosis and unnecessary treatments. Adjusting the medication dose or switching to an alternative drug often helps resolve these symptoms before they become disabling. 7. Severe cardiovascular complications. In a paradoxical twist, amlodipine, a drug designed to protect the heart, can sometimes worsen chest pain or even trigger a heart attack, especially when treatment is first started or the dose is increased. Patients should be on high alert for the following warning signs: chest pain or pressure, sudden shortness of breath, cold sweats, weakness or lightheadedness. If any of these occur, it's essential to seek emergency medical care immediately to reduce the risk of a heart attack or severe heart failure. One possible mechanism is a phenomenon known as coronary steal, where amlodipine dilates healthy coronary vessels more than narrowed or blocked ones. This can divert blood away from areas of the heart muscle that are already starved for oxygen, worsening angina, or even precipitating a heart attack in patients with pre-existing coronary artery disease. Additionally, a sudden drop in blood pressure, particularly at the start of therapy or after a dosage increase, can cause dizziness, lightheadedness, weakness, or even fainting, significantly increasing the risk of falls and secondary injuries. In severe cases, this sharp drop in pressure can reduce blood flow to vital organs, impairing their function. Amlodipine can also disrupt the heart's rhythm, causing arrhythmias such as abnormally slow heart rate, bradycardia, or excessively fast rate, tachycardia. Patients may notice palpitations, mild chest discomfort, or shortness of breath. Sometimes the body reacts to low blood pressure with reflex tachycardia, a rapid heartbeat intended to maintain circulation, which ironically increases the heart's workload. For these reasons, regular monitoring of both blood pressure and heart rate, especially during the first few weeks of treatment, is absolutely critical. 8. Taste disturbances. Beyond the cardiovascular side effects, some patients experience a sudden disruption in their sense of taste. Flavors may seem bitter, metallic, or completely bland, and in some cases, the ability to taste anything at all can disappear. This unexpected change can ruin the enjoyment of food, reduce appetite, and even increase the risk of consuming spoiled or unsafe food. Such alterations not only affect nutritional health but also negatively impact mood and social life. While the exact cause remains unclear, it's believed that amlodipine interferes with calcium channels in the taste cells, disrupting normal taste sensation. 9. Abnormal gum growth, gingival hyperplasia. A less common but noticeable side effect of amlodipine is the gradual thickening and overgrowth of gum tissue, affecting about 1.7% to 3.3% of patients, slightly more often in men. This usually begins within the first 3 months of treatment and, if left unaddressed, can cause gums to grow enough to cover part of the teeth. This overgrowth results from altered calcium metabolism and increased collagen production in the gums. When the balance between collagen breakdown and formation is disrupted, fibrous tissue gradually accumulates. The presence of dental plaque and local gum irritation further accelerate this process, as inflammation promotes more tissue growth. Initially, the gum thickening appears mild and often between the teeth, but over time, the gums become firm, fibrous, and noticeably enlarged, with a pale pink or reddish color. This condition makes oral hygiene more difficult, brushing and flossing become challenging, and can interfere with chewing and speaking. Aesthetically, significant gum overgrowth, especially around the front teeth, can cause embarrassment and discomfort during smiling or social interaction. Awareness is the first step in caring for ourselves and our loved ones. If you found this video helpful, please share it with others. This simple information might save someone's life. Stay informed and healthy.